Hi everyone, I'm Nina. Welcome to the Mexicali Bariatric Center YouTube channel. Today I would like to talk to you about revisions from sleeve to DS. I wanted to share two cases that we had last month, which I found very interesting. First case, we had a lady contact us. She was in her mid-40s BMI. She had had a sleeve done several years ago. She hadn't been very successful. She was sure she was eating too much. She was sure that her sleeve was too big. So she was considering having her sleeve redone and then having the DS portion done as well. So we scheduled her, and it was agreed that the day before surgery, when she came in for her test, we would check her sleeve and determine if in fact it needed to be re-sleeved or not. Same day, we had a lady scheduled that she had a band. She had converted to a sleeve. She knew she could eat very little. She was sure that her sleeve was small, but she had lost very little weight, and in fact she was starting to regain. So she knew she needed the second part. She needed the malabsorption of the DS. We would recheck her sleeve and just make sure that we were doing the correct thing. So ladies come in the day before surgery, and we do case number one, the lady in her mid-40s BMI. And sure enough, we do the x-rays, and the sleeve was very big. It had bulges on the top, bulges on the bottom. Basically, she had a sleeve that could hold two or three times what a tight sleeve holds. So we decided that yes, she needed to have the sleeve redone. At the same time of having the DS. At that point, we thought, well, that is probably the reason why she wasn't successful. If she would have had a tighter sleeve, a regular sleeve, not so irregular, she might have been successful. This is what we were thinking. And then the second case, the lady with the low BMI, her sleeve was very, very tiny. It was very nice. So, we stuck to the plan, just doing the DS part. So the day of surgery, the first lady goes in, and the doctor re-sleeves her. And when he starts doing the DS part, he needs to measure in order to determine the length of each limb. And he measured, and the lady had a very long intestines, way over the average. If the average is 6, she was close to 9 meters of intestine. So the doctor knew at that point that even with a tight sleeve, she most likely wouldn't have been successful even with a small sleeve, that she needed the malabsorption. So he was very happy that she had decided to have both parts done and not stay just with the re-sleeving. The second lady comes into surgery, and again, the doctor starts measuring. He doesn't do anything to the sleeve, starts measuring. And again, this lady has very long intestines. It wasn't close to 9 like the other lady, but I think she was at 8.4 meters of intestines. Again, very long, way over the average. So that means that these ladies could absorb more fat, could absorb more carbs, more calories, basically. So this is why the lady that was eating very small portions, she wasn't being successful. She needed more. Cutting portions was not enough for them, either of them. So we were very happy that they had scheduled the second part, and we're sure that they're going to be very successful. I was very excited, and immediately told the doctor, well, how can we know? Is there a test that we can have patients do at home, an x-ray or something that they can do to find out what the length of their intestines are in order to determine if they need a DS right from the get-go and not have to wait until a sleeve fails? And sadly, the answer was no. There's nothing that they can have done at home, that's not invasive, to determine how long their intestines are. It's at the time of surgery, when the doctor is actually measuring, that he knows if it's longer than usual. But at that point, the patient is already in surgery. So it's just good information to have, and good information for patients considering to go with a malabsorptive procedure like the DS or the bypass. Do you notice that when you eat small portions, you don't lose weight? Do you think you need more? Then that's something to consider. I hope this helps. I hope to see you soon.